Surgical wounds are classified into 4 main types based on their contamination levels. Clean wounds. These are uninfected surgical wounds where no inflammation is encountered. The respiratory, gastrointestinal, genital, and urinary tracts are not entered. Examples include surgeries like orthopedic operations, such as knee replacement or a mastectomy. Clean-contaminated wounds. These involve surgical procedures where the respiratory, gastrointestinal, genital, or urinary tracts are entered under controlled conditions and without unusual contamination. Examples include a cholecystectomy or removal of the gallbladder or a hysterectomy. Contaminated wounds. These are open, fresh, accidental wounds or surgical incisions in which there is a major break in sterile technique, or gross spillage from the gastrointestinal tract. There is a higher risk of infection due to the nature of the procedure or wound. Examples include surgeries where there is spillage from the intestines, or surgeries performed on inflamed tissues. Dirty or infected wounds. These wounds involve existing clinical infection, or perforated viscera such as an abscess, infected wound or perforated bowel. The wound is likely to have microorganisms present in high numbers before the procedure. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.